So this morning we've heard at the press conference, we have heard results from Pacific trial, the FLAURA trial, and also about a trial about CT scanning and imaging and follow-up of patients. Could you tell us about the biggest practice-changing moments for you?
We have two important information plus one about the screening on lung cancer. I think the practice-changing results will be represented by the Pacific results and FLAURA results as soon as agency approval and reimbursement of the drug will enter in each country. The Pacific trial tell us that durvalumab is a valid option to offer to our patient in stage 3 non-small cell lung cancer after chemoradiation treatment. Be careful. This stage is not advanced metastatic stage. This is a locally advanced stage where the patient has a big mass, has a big tumor, has a nodal involvement, but has not yet distant metastasis. So therefore is not suitable for surgery, but is not suitable either to supportive or palliation care. So he will be treated with the local approach, radiation, systemic approach, chemotherapy. This is the standard of care of stage 3 patients, and these treatments are concomitant, so chemo, radiation, and after, until today, we didn't know nothing. We just wait for relapse and monitor the survival. Now we know that adding immune therapy, and in particular durvalumab, we can really increase the survival without progression in these patients, and probably we will prolong also the overall survival. In the FLAURA study, we know now that after erlotinib, gefitinib, and afatinib, which are the standard option for first, second generation EGFR tyrosine kinase inhibitors, we now know that the third generation inhibitor, osimertinib, maybe is the best option to offer in EGFR mutated lung adenocarcinoma patient in the metastatic stage. So stage 4. This approach improves progression-free survival, improve the control of distant metastasis, included brain metastasis, and so also in this case we will improve their overall survival. So these are the two important results in terms of treatment of this patient. The third study take care of follow-up of resected patients. As Enrichetta Felipe said in the press conference, maybe these results, which compare a minimal approach with the chest X-ray versus a maximal approach with CT scan every 6 months in the first 2 years and then annually, yearly in the following years, says that in the first 2 years must probably there is no difference in terms of overall survival between CT scan and chest X-ray, but there is a trend in favor of overall survival in favor of a CT scan monitoring after the second year. So maybe by this data we know that in the first 2 years monitoring lung cancer patients operated for early disease can be followed up with chest X-ray or CT scan. Is the same thing. These are scientific data and evidence-based medicine. But because of a trend in favor of a CT scan, we can understand that this benefit may be derived by the ability of a CT scan to detect second primary cancers. And very often, a patient with lung cancer resected and so cured for lung cancer can develop second lung tumors because they are smokers and the exposure to the carcinogens has involved all the lung. So most probably by this study I will not change my way to follow up patients. Usually I follow up my patients with the CT scan, and maybe I will continue to follow up this patient because I have to monitor second primary tumors, but maybe instead of do CT scan every 6 months I will delay the control.
Okay, so maybe you might do it after 2 years or just once a year?
Once a year or every 8 months. I don't want to, I mean, I still in love with CT scan.
Do you find that your patients find that reassuring to be followed up?
If I was a patient, I hope not, but if I was a patient, I would be followed by CT scan. You know why? Also because if I have a relapse of my disease, to detect a relapse in an asymptomatic stage, and the CT scan is much more sensitive than chest X-ray, I can be treated with a second surgery, with a more accurate treatment. So maybe I will continue to do CT scan.
Brilliant. Thank you very much.
Thank you.